Why blood sugar drugs are a mistake. Dear diabetic friend, the diabetes industry wants to make you a daydream believer. Here's the fantasy. It wants you to keep pretending that you can eat the same foods that upset your blood sugar in the first place, just as long as you take drugs to lower your blood sugar afterwards. Shame on them. This is absolute insanity, and medical studies show you the shocking proof. Lowering your blood sugar with drugs can be deadlier and more dangerous than not taking the drugs at all. Results from the 2008 Accord study confirmed this. Researchers examined the risks for heart attack, stroke, and death in 10,000 diabetic patients. Those who reduced their blood sugar levels the most, to 6% A1C or lower, which is considered great by doctors, had a higher risk of death compared to patients who did nothing and allowed their blood sugar to rise between 7 and 7.9%. As blood sugar levels dropped, more patients were having heart attacks or dying. In fact, the study had to be canceled to protect the remaining participants. This is completely contrary to what most doctors and the American Diabetes Association tell us is the best way to treat diabetes, yet they haven't changed their treatments. There is only one way to cure type 2 diabetes. Fact: as long as you take these drugs, you will always have diabetes. There has never been a case of these drugs curing a single diabetes patient so that he or she could discontinue taking them. Not one. On the contrary, diabetes drugs make type 2 diabetes worse faster. Fact: one day your pancreas, the organ that produces insulin, will burn out from all this artificial stimulation from diabetes drugs. When that happens, type 2 diabetes will officially become type 1, and you'll need to inject insulin for the rest of your life just to stay alive. Then you will have lost your chance to return to a normal life forever. Fact: your only hope of getting off drugs and reversing your diabetes is cleaning up your diet and getting off the couch. Researchers call this lifestyle modification, and in study after study, no drug can hold a candle to its success. That's just not true. This huge misconception is gleefully perpetrated by the diabetes industry, which stands to lose a fortune if the world's 300 million diabetics discover the truth. They've brainwashed the public and doctors into believing that diet and lifestyle modification is a painful, sweat-drenched path requiring super willpower, starvation, hunger, weight loss, and deprivation. Fact: you don't need to lose weight to reverse your diabetes. Fact: you don't need to become an exercise nut. Fact: you don't need to go on some weird diet. And Diabetics will prove that it's much, much easier than that. Before taking Diabetics, most diabetics were turned off to diet and lifestyle modifications because they thought it involved too much hard work and sacrifice. Diabetics represents a real cure for type 2 and pre-diabetes that can allow you to quit sticking your fingers with needles and testing your blood sugar. Discontinue all those sickening and fattening diabetes drugs. Stop feeling guilty about food and trying to lose weight. End your worries about diabetic heart attack, amputations, or blindness, and return to a normal drug-free life. Wouldn't it be great to kick diabetes out of your life like this? Wouldn't it feel wonderful to return to a normal life again? To have a second chance? To change the direction of your life away from the misery that lies ahead, and toward a future filled with good health, happiness, and increased longevity? I assure you that you can, and starting today. Learn more about Diabetics at diabetics.com.